And the first of our speakers is Dr. Brigid Ryan. And Brigid is a senior lecturer and researcher with the University of Auckland. And she's also the chair of YODET, the Younger Onset Dementia Aotearoa Trust. And Brigid's going to take us through some of the things we all should know about younger onset dementia in Aotearoa, New Zealand. Thank you, Brigid.
Thanks, Susan. I'll just share my screen. Hopefully everybody can see that now. Wonderful. So thanks to everybody for joining today. I'll start with my mihi. Kia ora tātou. No airangi, no kōturangi, hoki uku tupuna. Engari I tupu ake o I otipoti. Ke tawiki makoto aho I noho ana. Ko Brigid Ryan aho. He kairanga hauroru aho I waipapa tamataro. No reira tina koutou katoa. So as Susan said, I'm a neuroscientist at the University of Auckland, and my main research interest is young onset dementia, with a particular focus on frontotemporal dementia. As Susan also mentioned, I'm also involved with YODET, the Younger Onset Dementia Aotearoa Trust, and we provide services and support for people living with young onset dementia in New Zealand, and I'll talk a bit more about them at the end of the talk. So this is what I'm going to cover today. I'm going to start by defining young onset dementia. I'm sure there are many young onset experts in the audience, but I'll start with that just so we're all on the same page. And then I'm going to summarise what we know about young onset dementia in New Zealand from research that I and many others have performed. And then I'm going to finish with an overview of the support that's currently available in New Zealand and a comment about the support that I hope will be available in future. So what is younger onset dementia? It's defined as dementia of any cause that has symptom onset before the age of 65. So even if someone isn't diagnosed until they're 67, as long as their symptoms started before they were 65, they meet the definition. Young onset dementia means the same thing as early onset dementia, which is sometimes used, but we prefer the term young onset because early onset can be confused with early stage dementia, which is of course a different thing. So in general, dementia is thought of as affecting older adults, and this makes sense because the risk of dementia does increase with age. But what's not often appreciated is that quite a large proportion of those living with dementia are actually under the age of 65, and people can be as young as in their 20s. So the most common causes of young onset dementia are Alzheimer's, frontotemporal dementia, and vascular dementia, and Lewy body dementia is probably in there as well. But together, these three diagnoses here, Alzheimer's, frontotemporal and vascular, still only account for between 50 and 75% of all cases. So what this means is that there are quite a few people who have more rare causes of dementia in this younger group. Although Alzheimer's disease is still the most common cause in this younger group, it's much less common than it is in the older group. So if we look at an older group of people with dementia, about 2/3 of them would have Alzheimer's disease, whereas in a younger group, in the younger cohort, only about 1/3 have Alzheimer's disease. So as I said, what this means is that quite a large proportion of people with young onset dementia have conditions that are caused by rarer diseases, and this can make diagnosis more difficult. Young onset dementia is also more likely to be genetic than later onset dementia, and this is because almost all genetic dementia presents before the age of 65. So when I say genetic here, I'm talking about dementia that is directly caused by a genetic mutation. So why does age matter? Well, although the cutoff of 65 is biologically arbitrary, we think it's important in a number of ways, which I'm sure many of you will be familiar with. So firstly, the retirement age in many countries, including New Zealand, of course, is 65, which means that the majority of people with young onset dementia are working when they first notice symptoms. And in addition to work and financial responsibilities, many people have young children or teenagers. And there are also differences in the clinical profile. So, for example, young onset patients are likely to be less frail as a direct result of their age. and more active. And finally, it's also really important to note that many health systems, including our own, are organised by age, often with a cutoff of 65, and this can present challenges to people who are under 65 but need access to dementia care. And in New Zealand, we know that people sometimes fall between the aged care and disability care sector. So for these reasons, people with young onset dementia face unique challenges that are different to those of people who develop dementia when we're older. And so we think it's useful and necessary to consider these differences. And we know that the experience of New Zealanders with young onset is different to New Zealanders with later onset dementia because of some of the research that's already been done here. So a number of researchers have done this sort of research by talking to people who are living with young onset dementia and also their care partners. And this sort of research is summarised in this slide. So, for example, some of the sort of thoughts about it that people have had when this research has been done is illustrated here in this quotation. So this person has said, talking about her father with young onset dementia, the activities weren't to his satisfaction. I'd like to see somewhere for people who are a little bit more active. He's still fit enough to have a life. Why take it away from him? And this was particularly talking about someone who was in respite care. And this is a common opinion that we hear from people, that the services are just not age appropriate. And this work from Alzheimer's New Zealand in a qualitative report that they did in 2019, where they interviewed 11 people with young onset dementia. What they found is summarised in this quote, that younger people with dementia want services tailored for their age group. So collectively, this type of work, talking to people, has really illustrated the importance of and the desire for age-appropriate services in New Zealand. So in terms of how people are affected in Aotearoa by young onset, we have also done some work which was slightly different, where we've looked at a larger number of people, and we've used routinely collected medical data to compare the health and well-being of over 1,300 people with young onset dementia. And we compared these people to over 45,000 people with late onset dementia. And the point of this was to see if there are differences in the experience of people with young onset compared to late onset. And what these data demonstrated was that there are really important clinical and social differences between the younger population and the older group. And I've highlighted some of the important findings that we've found here. So, for example, we found that there was a higher prevalence of what we describe as neuropsychiatric symptoms and problematic behaviours in the younger group. So neuropsychiatric symptoms are things like depression and anxiety. And problematic behaviours are things like being aggressive. And we also found that young onset patients were more likely to experience financial strain, which makes sense when we think about the age group that they fall into. When we looked at the care partners, we found that young onset care partners were more likely than older onset care partners to experience distress, anger or depression, and feel overwhelmed. So what this study does is it supports the conclusion that age does matter for New Zealanders with dementia. So our next question as researchers was, how many New Zealanders are actually affected by young onset? And surprisingly, this question hadn't been answered before we did this work, which we published in 2022. So to do this, again, we utilised these routinely collected New Zealand data sets that capture almost all of our population, and they include anonymised data from New Zealanders, which relates to both clinical information and also demographic data. So we use these data sets to identify people who had a diagnosis of dementia and were under 65. And what we found was that there were about 3,500 people who we could identify from these data sets who had a diagnosis of young onset dementia. We were looking at data from 2016 to 2020, and we found that this prevalence, or this number, was really similar across these years. So in other words, if you take 10,000 New Zealanders who are aged between 30 and 64, you'd expect to find that 14 of those New Zealanders have been diagnosed with young onset dementia. And we found that this is quite similar to previously reported international data. And when we look at this data compared to the same data set when people are in the older age group, we found that this represents 7% of all cases of dementia in New Zealand. In terms of the actual age split, about a third of these people were between 60 and 64, and the majority are over 45. But there are still a number of people who are under 45 in this cohort. Ito is going to talk a lot more about how we can count the number of people in New Zealand and predict the number of people in New Zealand with young onset dementia after I've spoken. So this information in terms of how many people are affected is really important for healthcare delivery, obviously. We need to know the patient numbers so that we can plan for and provide appropriate support. And it's also really important to establish some baseline numbers so we can track if there are any changes in the prevalence over time. So as part of this work, we were also really interested in the ethnicity breakdown in this cohort of people with young onset. And as you can see here, Māori and Pacific were both overrepresented. So this graph shows the number of people in each ethnicity group, which are coloured in different colours. And you can see that Māori, who are represented by the purple bar, and Pacific people who are represented by the blue bar, both have a higher number than the Asian and European ethnicities. And these differences of 1.8 times and 1.5 times are actually even greater than the differences we see when we look at the older group with dementia. And so what this finding means is that we need dedicated and culturally appropriate resources, which won't be a surprise to anybody in the audience. So I mentioned that young onset dementia is caused by a number of different conditions. So what we hoped in this study as well is that using this data, we could find out a little bit about which particular conditions are causing young onset dementia in New Zealand. But unfortunately, what we found was that in many cases, the condition that actually caused dementia, so whether that was Alzheimer's dementia or frontotemporal dementia, for example, it wasn't actually recorded in the medical records. And so you can see that this big dark purple section here is people who didn't have a specific diagnosis recorded. They were just recorded as unspecified dementia, which is not very helpful for us. So this was quite disappointing that this data wasn't very helpful to answer this question of what conditions are actually causing dementia. And it means that we're not able to accurately report how many people have each subtype of young onset dementia in New Zealand. So it's also really important, as well as knowing the total number of people in Aotearoa who have dementia at any one point, it's also really important to know how many people are newly diagnosed each year so that we can provide support to them. And this is what we've done in this paper, which was led by Ito, and again published in 2022. So what we've done in this work is we looked through records from Waikato Hospital, plus a number of neurology clinics in the Waikato region. And we were able to, basically what we were trying to do is count all of the people who had a new diagnosis in the Waikato area over a 3-year period. And we were able to identify 64 new diagnoses in this period. So this was between 2015 and 2018. And if we extrapolate this number to the whole population, this suggests that when we look at Aotearoa as a whole, we would expect that 220 new diagnoses of young onset dementia are made each year. So again, this is helpful for us in terms of healthcare delivery and making sure we support these people. And again, this data suggested that there was a higher incidence in Māori compared to a non-Māori, which supported our previous work as well. So as I've already mentioned, diagnosis of young onset dementia can be more challenging than diagnosis at a younger age. And this is for a number of reasons, including that there are rarer subtypes. Dementia may not be suspected in younger people, and perhaps a lack of awareness among health professionals in some cases. We know that timely and kindly diagnosis is critical to patient and care partner well-being, even in the absence of available treatments. And so we've recently done some work to investigate young onset dementia diagnosis in New Zealand for the first time. And this is to find out whether this timely and kindly diagnosis is happening or not. This work was funded by Alzheimer's New Zealand, and Shruti Sharma is a wonderful student who's done a lot of work on this project. So what we did in this paper, or in this research, is we recruited people with young onset dementia and their care partners, and then we gathered information about their diagnostic experience using both questionnaires that were completed by the patient and their care partner, and also we accessed their medical records with permission. And what we were trying to understand is what's happening right throughout the process, from first suspecting something might be changing all the way up to actually getting a diagnosis of your dementia subtype. So I'd like to really acknowledge all of the participants who took part in the study from around New Zealand for generously sharing their stories. So what we found was that on average, it takes 3.6 years to get a diagnosis of young onset dementia in Aotearoa. So this is right from the point where someone suspects that something might be changing, all the way up to getting a diagnosis of general dementia. And this is very similar to the time that it takes in Australia that previous research has found out. And it's most likely longer than the time it takes for older people to get a diagnosis. We didn't look at that directly in this study, but previous work indicates that this time taken is longer in young onset compared to late onset when you do directly compare that. So when we asked care partners what they thought about this, 40% of them said that this was too long. And the feelings about this was summed up in this quotation when one of our participants said, the journey has been long and frustrating. So in terms of the pathway to diagnosis and what actually happens along this pathway, we found that there's a clear role for GPs in detection of suspected young onset dementia, because almost all patients present to their GP first. So when they think that there are issues, the first place that they go is to their GP. So that was 92% of all patients did that. So New Zealand guidelines recommend referral to a specialist for all suspected cases of young onset dementia. So this means that when someone presents to their GP, they should fairly quickly get referred on to a specialist. And we did see this happening most of the time. So in 50% of cases, GPs referred to a specialist within 3 months, which is great. But we did find that in a quarter of the cases, the GP didn't refer the patient for longer than a year. And we think this is an area that can be improved. It shouldn't take that long to get a referral to a specialist. All patients were ultimately diagnosed by a specialist, and this was a neurologist in 3/4 of the cases. So this work is under review at the moment and will hopefully be published soon. So the next step in this project, which we're currently undertaking, is to find out a bit more about the experiences that these patients and families are actually having. And to do this, we've conducted in-depth interviews with some people that were involved in this study so that we can get a better idea of what their experience has actually been like. And this work was funded by the Neurological Foundation, and it's been led by Dr. Ashley O'Mara-Baker. So Ashley has conducted 13 quite long interviews with care partners, patients, and also clinicians. And in this case, it's all of the people are from the Auckland region. And what I've done here is summarize the main takeaway messages which Ashley is finding from these interviews. So before diagnosis, there are often delays in presenting to the GP, which could be for a variety of different reasons. And people found that they were referred to multiple doctors before they found one that can help, which obviously slows down the whole process. They found that there were discrepancies in outcomes and experiences depending on whether you're in the public or the private system. And people also found it hard to navigate issues around enduring power of attorney and advanced care planning. After diagnosis, so in this post-diagnostic phase, our interviewees reported that services and resources appropriate for young onset dementia were really hard to find, including but not limited to day services, respite care, and also long-term care options. And they also reported that funding systems are rigid and difficult to understand. So with all of that background, what can I tell you about the support that actually is available in New Zealand? First of all, I just wanted to mention a little bit about YODAT. So Young Onset Dementia Aotearoa Trust, which Susan's already mentioned I'm the chair of currently, This is a not-for-profit charity which was established in 2015, and our aim is to improve the well-being of New Zealanders with young onset dementia, their families and whānau. So what we do is we do provide some services and supports specifically for people with young onset, but we also work really closely with other providers. So we want to be really collaborative and share our expertise and anything we can to help other providers to provide services and support as well. So I'm happy to report that services and supports are becoming more available around New Zealand, although we've still got a lot more work to do. And these are things that are provided by Aotearoa, but also by many other different providers, including the various dementia community organisations. So for example, we do have some day services which provide both activities for people living with dementia and also some respite for their care partners. And these are available in some areas across the country. We also provide some support groups. So there are various in-person support groups across the country, and Aotearoa also provides some services, some support groups which are available to all New Zealanders because they're online via Zoom. And there is also some help provided by Aotearoa and other providers to navigate the health system and identify financial support, particularly, which can be particularly difficult when you're in the younger group. So if you'd like more information about the supports that are available to you specifically in your region, I'd advise you to either contact your local dementia organisation, or you can contact us directly at aotearoa.org.nz. And one of the things that we want to do, that Aotearoa wants to do, is make sure that on our website we've got a good summary of the available resources and supports that are available. So if you can't find things in your own region, please get in contact with us and we'll see if we can find what's available. And on that note, if you know of, if you have a look at our website and have a look at our resources page, and you know of other supports or services that we haven't listed or that we're not aware of, please do let us know. And I'd also like to make another little plug for Aotearoa, which is to acknowledge that we currently lack Māori and Pacific representation on our board. So if you can help us with that, if you're interested or you know anybody who's interested, please do let us know. So I just wanted to end with my personal viewpoint about what support is actually needed. What work do we have to do? Where do we need to get to actually provide the required supports and services for people with young onset and dementia? So these are the things that I think are really important. Firstly, I think we need clear, easy to find information for people right from the beginning of the young onset journey. So we need help with navigating the health system. We need information about available services and support, and we need information about financial support, including really clear information about eligibility. And as well as this, we need just general information about what young onset dementia is, the diagnostic pathway, that sort of thing. And this is something that we hope that that Aotearoa's website can help with in the long term. Secondly, as I've already mentioned, we need timely and kindly diagnosis for every New Zealander who's diagnosed with young onset dementia. And this includes this prompt referral from the GP to the specialist, which I've mentioned. I also think we need dedicated young onset dementia clinics across the country. I'm sure Daryl and Erica will talk more about this. I think what's happening in Canterbury is a model that the rest of the country should follow. And we also need plans in place for post-diagnostic support right from that diagnostic meeting, so that people don't feel like they're given a diagnosis and then they don't have anywhere else to go. And finally, we need these tailored age-appropriate services and supports available across New Zealand. So at the moment, there are some parts of New Zealand where people have more availability of these sorts of things, but it's certainly not everywhere. So this includes respite care and day services, which include cognitive stimulation therapy that are obviously age appropriate, support groups, which are both in person and online, and finally specific tailored residential care for people with young onset dementia, which unfortunately is very limited currently. So thank you to all the collaborators that have been involved in this research. Special thanks to all those who've helped with participant recruitment. Most importantly, thanks to all of the participants themselves and the funders. And thanks to you all for listening. I'm very happy to take questions at the end.
Thank you very much, Bridget. Now, people can type questions in the chat and I'll pick them up, or you can raise your hand and Bevan and I will try to see you. We do have one question that's come in, just checking in about the best number to use for prevalence. I'm going to hold that over till after we've heard from Etu, because Etu is going to be talking to us about some of the figures, and then I might get the two of you to respond to that together. We certainly we've got Gillian saying that it's so good to hear more about Yodat. Thank you, Brigid, for letting people know about that and about the ever-growing website. I think one of the questions that we often does get raised in this network is around that thorny issue of aged residential care options. And Brigid, do you have any thoughts about what you have seen that is innovative and worth sharing, or where you see the major gaps that it's really important for us to be thinking about, first of all, for that aged residential care for people who are younger than most of the people going into residential care?
Yeah, absolutely. And this is something that we're actually getting quite regular, sort of almost weekly people contacting us through Yodat now asking about this and saying, you know, I've got a family member who's under 65 and needs to go into residential care. Can you give us some advice about where to go? And unfortunately, we're not able to recommend any providers currently. We're not really aware of anywhere across the country that's actually providing that service. So it is, Yodat is really interested in trying to do some work in this area currently. I think one of the issues with this as well is that many of the dementia organisations are quite obviously focused in people living in the community. And so that stage when you then get to living in residential care, there's not a lot of groups out there that are providing that support. So what we're trying to do is at Yodat currently is put together a business plan for a small group home style model. And we think that is the best approach, but we've still got a lot of work to do around how that would actually work, and you know, we're certainly not experts in providing residential care. So if there's anybody out there that would like to help us with that, or would like to put us in touch with organisations that would like to partner to do that, then we'd be very happy to hear from you. But yeah, I think the short answer is we think that sort of small group community homes are the way to go.
Fantastic. And Winifred has just let us know that in Epsom there is a facility called Elizabeth Knox that's been supporting younger people with disabilities, and it might be worth contacting them.
Yes, thanks so much, Winifred, and that is one of the places that we do recommend. So thanks very much for pointing that out.
Yeah, and a similar question from Gillian about the availability of respite care that is age appropriate.
Yeah, so I guess when I mentioned respite care, I was talking about the respite that a care partner gets when the person living with dementia goes to an activity group for, say, half a day. So that is available in some parts of the country. So, for example, Dementia Auckland runs a weekly session, and Wellington Yodat runs a twice weekly session. And Dementia Canterbury, obviously, which you'll hear about later, a similar sort of thing, and in other places across the country as well. So those sort of half-day respite options are becoming more prevalent across the country, but they certainly don't cover everywhere. But in terms of sort of longer term or overnight respite care, unfortunately, I think we have a similar issue that apart from the same respite care options that are available for older adults, I'm not aware of any places that have specific tailored young onset sort of overnight respite care options. So I think that's something that when I was talking about the sort of small group home, that's what we'd like to see, is that integrated into that sort of model as well.
I know that Daryl will be sharing some thoughts later on as well. We have a question just coming through from Lou about, do you feel that the current funding freeze on respite full-time residential care is or will be impacting on access that's needed?
I suppose it'll be impacting less in that there's not currently any specific young onset respite that's available, but certainly any reduced funding for respite care in general is not going to be good for targeted young onset respite care either. I'm certainly not an expert in what's happening in the sort of policy or government field. There's probably somebody else on the call who's will be better at answering that question.
Gillian's just chipped in to say that, as well as the countries we're going to be hearing about from Daryl, that community homes in Australia may be a bit further down the line than we are in terms of offering support for younger people, and there may be some really good models to check in from there as well.
Yeah, great. Thank you. That's really good to know. We've had a little bit of conversation with some people in Australia, but yeah, we're sort of starting to see if we're starting off to see if there's any if there are any models that we can use in New Zealand, which won't be young onset dementia, but sort of related conditions. But certainly Australia is on our radar. So thank you.
Yeah. And Christina is just making a comment about the fact that down south, she's had a concern from a GP that they're referring to specialists but are having their referrals declined and being advised to follow the cognitive pathway. And that's quite difficult in the context of young onset dementia. And she's just wondering if that's something that you've heard feedback from elsewhere in the country.
Yeah, so the cognitive pathways at the moment are specific to the area that you're in. So I think, as far as I understand, they're still related to the old DHBs. So when I have tried to find the information in all of the cognitive pathways, it's actually quite difficult to access all of that if you're not a clinician. But what I do know is that some cognitive pathways are clearer than others. In terms of the New Zealand-wide guidelines that we have, I think the most comprehensive is the BPAC guideline, and that very clearly states that all people with suspected young onset dementia need to be referred to a specialist. So I personally think that we need to set a national consistent cognitive pathway that includes that advice. But yes, I think that is a problem that is inconsistent across the country.
Oh, thank you. Aotearoa is always passionate about therapeutic recreational specialists, and she's just checking in about whether they are part of the MDT approaches and support for young people living with dementia.
Not that I know of, but they certainly could be. Again, there's probably someone else out there who's better at answering that question than I am, but thank you for pointing that out.
And I was just wondering whether you might like to share about the online support group, because that's something that some people may not be aware of.
Yes, absolutely. So we have a number of different online support groups. So these are run by Aotearoa, but we've had some really significant funding support from Alzheimer's New Zealand to get these up and running. So we have two different categories. One category is a peer support group, and that's for people who are living with young onset dementia. So that's run by someone who does have young onset dementia themselves, and that's really a group where people can get together and talk about their experiences. The second category is for supporters of people with young onset. So what we have there is a number of different groups of different categories of people who are sort of dealing with different stages of supporting people with young onset dementia. So we found that it was really important to have groups available for people where their loved one was still living at home with them, but then a different group available to people who where their loved one has moved into residential care, because those two experiences can be quite different. And we also have a group that has been running on and off, which is available for people who are adult children of people with young onset dementia. So that's aimed at that sort of teenager up to sort of 30s sort of demographic. So for information about any of those, and all of those groups obviously are online, so they're available to anybody across the country, and we can also help with any tech support that you need. So for more information about any of those, please have a look at the Aotearoa website and you'll see all the contact details there.
Yeah. A very sober question from Virginia, who is just inquiring about the prognosis in terms of how long do people with young onset dementia typically live for after diagnosis, and is it shorter than people who get the diagnosis when they're over 65?
Yeah, that's a really hard question to answer because it varies so much based on the individual. So it does vary depending on the subtype, the type of dementia that people have. And it also depends on a number of other factors. So this is something that we hear a lot from care partners, is that they really would like to know some concrete information about prognosis for planning for the future, but it's really difficult to give that information. It's also quite difficult to determine whether people live longer or less long when they're diagnosed younger. And that's partly because if you're diagnosed later, then your life expectancy is obviously shorter anyway. It is often reported that people with young onset dementia have a more accelerated course, so they do live for less time than people with late onset, but I don't think there's actually strong research evidence for that. So I think in general, the sort of averages that you see of sort of around 10 years post-diagnosis seems to be similar between young onset and late onset.
Thank you. You're doing amazingly, fielding, just a whole range of questions. Perhaps one that we have got coming in is about the links with head injuries and whether that's something that's particularly relevant in the younger onset dementia area.
Yes, that's a great question. So I work very closely with Dr. Helen Murray, who is the sort of New Zealand expert on the neurodegenerative consequences of repeated head injury, along with a number of other researchers. So this is something that she's specifically looking into at the moment. And what we do know is that CTE, or chronic traumatic encephalopathy, or the neurodegenerative diagnosis that is associated with repeated head injury, that almost always affects people in that younger age group. So most people who are affected by that type of degeneration, which can cause this dementia, these people are in the young onset group. So we're certainly really interested in that category of people. Unfortunately, the data for New Zealand is really difficult to identify, and partly that's because of the issue that I mentioned, that the actual subtype of dementia is not always well reported. But also when we're looking at this repeated head injury group, it's even more complicated because we know that it's not necessarily a sort of a serious head injury like a concussion that might be reported that is related to that dementia. In some cases, it's these much more minor repeated head injuries, which may not actually be recorded anywhere in your records. So in summary, it's really difficult to get that data, but there are New Zealand researchers who are really interested in it, and it's currently something that's being looked into.
Yeah, and I'd just like to echo the compliments that are coming through, both for the work of Aotearoa and for just sharing so much knowledge that you're passing on with us today. We really appreciate it.